My name's Rush. I'm a nurse practitioner here at Stanford's Otolaryngology department. Today, I'm going to talk to you about how to use a saline spray. Your provider may have asked you to use saline rinses to help with your overall nasal mucosal health and to clean out your nose. Sometimes patients find that to be a little aggressive. An alternative is to use a simply saline spray that the ingredients is pretty much the same as the saline rinse or the neti pot that you have, but the delivery is through an aerosol can. I'll show you how to use it. Essentially, you want to take off the top. Because it's an aerosol can, the delivery will gently spray the inside of your nose and coat the inside of your nose. If you want to know how to use the saline rinses, you can go to our website and click on the videos, how to use a saline rinse, and that'll demonstrate how to use the saline rinse. With the saline spray, you want to be over a sink or in the shower. It's important to take the can in one hand and point the nozzle inside your nose of the opposite side. So right hand, left nostril, point the nostril towards your cheek so that the spray can coat the inside of your nose. Tilt your head over the sink and gently spray. The aerosol can will deliver a gentle mist inside your nose. Then switch hands, left hand, right cheek, point the nozzle towards your right cheek, tilt your head, and gently spray. You can do this about 2 to 3 times a day, again, just to help coat the nose, help with dryness, remove the discharge from your nose, and just the buildup that you have. If you have any other questions, please feel free to reach out to your provider or contact our clinic. Thank you.